now official. The union government has fixed the price of vaccines administered at private hospitals at 250 rupees for a dose for those above 60 years of age and those above 45 years of age with comorbidities starting the 1st of March. Now, vaccines administered at government hospitals will be free of cost. Now, the 1st of March, which is Monday, so starting Monday, India's COVID vaccination drive will open up for those over 60 and for those over 45 years of age with comorbidities and at both government and private hospitals. And in a major policy move, the centre has also scaled up the participation of the private sector. For more on this big story, let's go across to Akshay Dongre. He joins us now. Akshay, you know, this was the million-dollar question on everyone's mind. How much will the vaccine cost once it's opened up to the public? And given the experience of the price fluctuations reported when there was excess demand for COVID testing, the government seems to have preempted all that by capping the price at the start itself at 250 rupees.
Well, exactly, Sarah. That was the million-dollar question, as you mentioned. And everyone was wondering that even if the COVID vaccines are available at the private facilities, because not a lot of people were very optimistic of getting their chance as far as the government facilities are concerned. So the question was that how much will it cost? And now the government has clarified that the capping will be 250 rupees so that everyone who has to get a COVID vaccine or who rather is eligible to get a COVID vaccine can either go to a government facility where they will get it for free of cost, or they can opt for a private hospital where they will get it for around 250 rupees. That is the maximum, and the hospital cannot go beyond that.
And Akshay, given the fact that we're a country where 75% of all the outpatient healthcare, 55% or so of inpatient care is typically provided by the private sector, it was only expected that private sector participation will be fully roped in or has to be roped in. It's only natural if we want to scale up, which we do at this stage, given so many states are reporting a resurgence in cases.
Well, exactly, Sarah, because the involvement of private sector was not even called for by the private sector, but also by the public, because the large number of hospitals, as far as the private hospitals are concerned, those were very important as far as a major scaling up of vaccination process is concerned. So as far as the number of hospitals are concerned, the government has said that around 10,000 hospitals that are covered under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, they will be used. These are the private hospitals as well as the other hospitals. As far as the CGHS facilities are concerned, there are 687 CGHS hospitals that will be used as COVID vaccination centers. Also, one very important point, what is going to be the role of the state? So the states will be, they have been given freedom to use the hospitals, the private hospitals that fall under the state government health insurance scheme. So the state governments can use them as COVID vaccination centers as well. And the most important point here, that is also that the states have been given freedom to use the public sector undertakings and the government health facilities as COVID vaccination centers. So a large scaling up of all of this operation is to be started from the 1st of March. So we can expect many more people to be vaccinated in the coming days.
And actually, quickly, I'm not sure if we have the answer to this question out there, if the governments come clear on this. Now that the vaccine is going to be available at private facilities, will somebody or the person getting the vaccine have a choice of choosing which vaccine they would like to take?
Well, that is one question that is still not very clear as far as the government is concerned, because the government has been very quiet as far as the choice between the vaccinations are concerned. We have two major vaccines, one is Covishield and one is Covaxin, and both of them are to be distributed, if not equally, but in large scale. So the option part is still not very clear, and it is not likely that the options will be given as far as the vaccination process is concerned. But definitely that is something that the government should clarify.